Well, good evening, everybody, and welcome to our first Hoover Together event. My name is Anne Marie Harvey, and I'm the Executive Director of the Hoover City Schools Foundation, but tonight I'm here in the capacity as one of the founders of Hoover Together, along with some of my classmates at Leadership Hoover. I have Tracy Trudis-Mukes right here, Tony Halsey back there, and Caroline Hollingsworth right there. So we also have two other members, Miguel Vilches and Alan West. And so this has been our project so far for Leadership Hoover. And Hoover Together is going to be, it is in the works, a first of its kind resource for our city, and it is a collaboration between local schools, government agencies, businesses, and community organizations to strengthen connections and provide vital resources to those in need. So our mission is to bring together people to create partnerships and provide comprehensive services and programs that empower families and individuals to thrive. Okay, all that sounds great, but what does it actually mean? What it means is that we are creating a website that will house all of those important resources that people need and don't know where to look for them. So this is particularly right now, as we kind of are facing a mental health crisis, this is where we're starting with that emphasis on mental health. And we plan on adding more things to it as it evolves, but right now we kind of narrowed our focus, and that's where we're starting. So we're going to have topics from every section of mental health that you could think of. We'll have article links, we'll have videos, we'll have events like this one tonight. We're hoping to do several a year. And we hope that tonight's event will open up the conversation for more discussion among our families and our children, and we look forward to doing more events throughout the year. So tonight we have two speakers here to share what they are seeing in their daily work, and then we'll have some questions throughout. As you think of some things you might want to ask, you can either ask during the presentation to one of our speakers, or you can put it on those pieces of paper and pass it up to me, and I will sort of moderate that. So I'm pleased to introduce tonight Meesha Emmett and Dr. Leesha Ellis-Cox. Meesha is the Alabama Area Director for the American Foundation for Suicide Prevention, where she served as a volunteer for 9 years prior to being hired. Her work with AFSP began after the death of her best friend in 2013. This life-altering loss ignited a passion within Meesha that has led to her working tirelessly to advocate for stronger and more effective mental health resources for all Alabamians and to educate communities, individuals, and especially the youth about mental health and suicide. Meesha is a native of Florence and has a BA in Public Relations from the University of Alabama. She has more than 15 years of experience in the nonprofit sector, working primarily in communications and fundraising. She serves on the board of directors for the Community Investment Network and the National Conference for Community and Justice. She is also the DEI chair for the Junior League of Birmingham and a member of Delta Sigma Theta Sorority Incorporated. And then we have Dr. Leesha, who is affectionately known by Dr. Leesha to all her patients. She is a double board certified psychiatrist, wife, mother, author, visionary, and maternal wellness strategist, and I feel so tired hearing all of those things because you are one busy lady. Leesha is a native of Raleigh, North Carolina, and earned both her Bachelor of Science and Doctor of Medicine degrees from UNC at Chapel Hill. She completed her general psychiatry residency training, child and adolescent psychiatry fellowship, and community mental health public psychiatry fellowship at Emory University School of Medicine in Atlanta. Since 2009, she has lived and worked in Alabama and provides psychiatric services to children and adults at several community mental health centers in and around Birmingham. She also maintains a private practice, Cox Psychiatry and Wellness. Dr. Leesha is a regular blogger at www.drleesha.com and uses her platform to destigmatize and educate about mental health. She is the author of 2 books, the Amazon bestseller Ditch the Mommy Guilt, A Blueprint for the Modern Mommy, and a beautifully illustrated children's picture book entitled The Love Garden. So ladies, I invite you to come up here and tell us, why are our children not okay?
That'll work. Good evening, everyone. How's everybody? Good. Thanks for coming. Despite our direction woes, but I see that everyone made it. I'm going to use the microphone because As a psychiatrist, I need to utilize my soft, soothing voice, and sometimes it does not carry so well. So I will be speaking from here. So this evening we are talking about our children are not okay. And as all of you are aware, it's been a rough go. The pandemic was not kind to many of us. People lost loved ones and really struggled with the isolation. We have had a tough year for our students with deaths of other students that have been really difficult. It's just a difficult kind of socio-cultural climate, and there are a lot of things that are really stressful, and we don't live in a vacuum. And as much as I think that we somehow think that our children are insulated from the challenges that are happening in the world, it's just not true. They are well aware social media has some advantages, but also presents some challenges for all of us, and especially our young people, and they're having a tough time. So we wanted to have this dialogue to really open up conversation, and this to be an ongoing conversation, because they aren't okay, and we're concerned, and we want to do something better about it. So I just wanted to start a little bit about Hoover City Schools, just so you know what our school district looks like. So there are 93,000 people who live in Hoover and call it home. We have over 13,000 students in the Hoover City School system. We have 16 schools, 10 elementary schools, 1 intermediate, 3 middle, 2 high, and 1 career education center. I have 3 children who are at 3 different schools, so that just tells you a little bit about our life. So we're doing our best. 52% male and 48% female. And then in terms of ethnic demographics, 55% white, 23% African American, 9% Hispanic, 7% Asian, 0.1% American Indian or Alaska Native, or Native Hawaiian or other Pacific Islander, and 5% or 2 or more races. And then the student-teacher ratio is 14:1, which does beat the average, which is 18:1. 35 school counselors and a college and career specialist. And then I've seen varying estimates, but we tend to spend a little bit more than the state average, anywhere from 12 to 14,000 students per year for Hoover City Schools. So let's talk a little bit about what the scope of the problem looks like. So I think I always like to give statistics because I think we need to understand what we're really up against, and data helps to drive that point home. So 1 in 6 youth will experience a mental health condition. And that's a high number of our young people. 50% of all lifetime mental disorders begin by the age of 14. So a lot of times the onset starts early on in their lives. And then, as I said, mental health disorders begin early in childhood, and then the prevalence increases with age. And then when we look at self-harm, 18% of US teens ages 14 to 18 report engaging in self-harm. And then looking at suicide specifically, second leading cause of death for youth ages 10 to 14, and the third leading cause of death for ages 15 to 24. We don't have the luxury not to talk about this and talk about it openly and honestly. And then 48% of firearm deaths were suicides, and 73% of all suicides were by firearms. So let's talk about what health and mental illness really mean. Sometimes those terms, particularly mental health and mental illness, get thrown around interchangeably, but they're not the same thing. But health, as defined by the World Health Organization, is a state of complete physical, mental, and social well-being, and not merely the absence of disease. And I think that's a powerful definition because you can still be healthy and pursuing health even if you've been diagnosed with something. Just because you have asthma or diabetes doesn't inherently mean that you're not healthy. And then mental health, by the World Health Organization, is defined as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Again, it does not have to entail that you have no diagnosis. You can still be working on your mental health and possessing positive mental health, even with a diagnosis. Mental illness, as defined by NAMI, the National Alliance for Mental Illness, is a health condition that affects a person's thinking, feeling, behavior, or mood, and deeply impacts day-to-day living and the ability to relate to others. So lots of times people will think, gosh, someone passed away and I'm feeling pretty sad. Maybe that's depression. Well, that's a normal response to a difficult life situation. And so we don't ever want to pathologize those kinds of experiences. You didn't study for your test and you're worried about getting a bad grade and you're getting anxious. That's normal. That doesn't mean that you have something that's dramatically wrong or significantly wrong. But when it interferes with the way that you want to live your life, so I always get anxious when I have to speak. My voice always is just a little bit shaky. I get a little case of the bubble guts, but I can come up here and I can talk to you, right? But if I ran out of the room and said I can't do this and didn't ever want to speak again, that would suggest that I was having more trouble because it was interfering with my ability to live life on my own terms. So we want to make that distinction between normal stressors that are just kind of difficult because we're human beings and life happens, but when it again interrupts with our ability to function. And then lastly, self-harm, also known as non-suicidal self-injury. So that's intentional self-inflicted damage to the body in the absence of suicidal intent and for purposes not socially sanctioned. So basically what that means is, and as I said, that was 18% of our young people that we can see, 14 to 18, that engage in self-harm. So that means oftentimes that you may have a young person who is feeling overwhelmed, super stressed out, and they are not using healthy coping skills. And so they may turn to cutting on themselves, scratching. Sometimes I see repeated erasures. That can happen to deal with stress. But the intent is not to die, but really to deal with emotional pain with a physical outlet, a physical expression of that emotional pain. So I'm going to cover a couple of different things, but first let's talk about some of the risk factors for suicide. There are a number of risk factors that we are aware of. So one is having a mental illness, being diagnosed with a mental disorder. Substance use disorders can also increase your risk. Trauma and adverse childhood events. So there's a lot of data about adverse childhood events that includes things like having a parent in prison, being in the military, having multiple moves, a history of physical or sexual abuse, neglect. So there are a whole host of things that are considered adverse childhood events. The more that you have, the higher your risk of negative outcomes. And these negative outcomes are not just relegated to mental health. They impact graduation rates, they impact employability, they impact relationships in the future, they impact your physical health. We know that prolonged stress increases your risk of a multitude of health conditions, but particularly cardiovascular disease. And so that's heart attacks, stroke. It can increase your susceptibility to other health conditions. So trauma is a big deal. That impacts a lot of different aspects of our life, including mental health. Gender. So women tend to be diagnosed more frequently with psychiatric disorders and tend to access services more frequently. Men die more frequently from suicide, and those are some of those differences that you can see with gender. Having medical illnesses can increase your risk of suicide, especially if someone has something that they feel like is futile, if they've been diagnosed with a terminal illness, that can increase your risk. Social media. Unfortunately, I think we're all aware of stories where we've heard that a young person may have died by suicide because of what they saw play out on social media. Cyberbullying is a phenomenon that happens, and so it gets posted. It gets posted all over social media. There's a digital footprint that doesn't disappear just because you delete it, and so someone feels completely in duress, and then they end up thinking this is terrible, and they make an impulsive decision. Bullying, stressful life events, moves can be difficult, parental divorces can be difficult, family history of suicide, access to firearms, and then the isms, which I refer to, racism and discrimination increases your risk, as well as issues with sexual minority youth can increase your risk, ageism as well. So warning signs that we need to be looking for with our young people and people in general. So, in our school computers, there's triggers for certain language that's used. So if someone is looking up how to kill yourself or suicide, it triggers the school, and then they will make a call because there's concerns about potentially a young person that may be thinking about suicide. Despair and hopelessness. Feeling like there's no other way. There's no hope, things will never get better. Feeling like a burden to others. Oftentimes, it's almost like you get, particularly if you talk about depression, you're in such a dark hole that you feel like life would be better, your family would be better if you weren't in it, because you feel like you have disappointed them and have made things so terrible. Especially with our young people, we are just not as important as parents. It's part of adolescence. It's a little bit painful sometimes. You go from your sweet, cuddly baby who wants to be next to you, sit in the bathroom with you, and then that's when they're really little, obviously. And then they're like in their room, door is closed. If you knock, what? But they want to spend time with their friends. But when that starts to change, they're not hanging out with friends anymore. They don't want to go anywhere. They don't want to go out to dinner and spend your money. They're not going to sporting events. That's a concern because the peer group is such a critical part of adolescence. Other behavioral changes, so academic decline. So you have a student that's really been doing well, and then all of a sudden their grades are starting to drop. They're not turning stuff in. They are much more irritable and grumpy. It seems like everything that you say just gets on them and bothers them. Again, they're withdrawn and isolated, and you're just kind of seeing all of this together. That gets concerning. And then mood changes. So, a lot of times the questions that I get are around how do you know if it's normal teen behavior versus something more serious? I think most teens are grumpy and irritable, at least part of the day, because they don't get enough sleep and you're getting on their nerves just because you breathe. But when you look at, again, you couple that with if they're not hanging out with their friends, they're no longer doing well at school, you just feel like you trust your gut and something just doesn't seem right. It's not just they're just grumpy because they're talking to you, but they're happy everywhere else. It's something that's different and consistently different. Then those are things that you want to pay attention to, those mood changes. And I like to pause here really to talk about the language that we use. The kind of culture around talking about suicide has shifted, especially when we use the terms, what we used to say, and I used to document in my charts, someone committed suicide or they completed suicide. But that's no longer really the way that we describe suicide. And so, committed sounds like you committed a crime. It's criminality, something bad that you did. Completed sounds like, typically we say completion is a sign of accomplishment or achievement. So the language that we use is someone died by suicide as opposed to committed or completed. And I saw this, I don't know what website I was on, but it said the litmus test is to substitute the word cancer. So if you wouldn't describe cancer that way, then you shouldn't describe suicide that way. So there are a lot of myths that we have about suicide and self-harm that I think are worth really exploring in a little bit more detail. So a lot of times there's reluctance and hesitation to talk about it because the fear is that if you say something, you're going to somehow encourage someone to go through it, or maybe you're going to bring up the idea they haven't even been thinking about at all. But a lot of times when someone is struggling and thinking about suicide, it really isn't something that just all of a sudden popped up. They may have been wrestling with it for some time, and sometimes when you actually take the time to ask, you give them permission to be honest about what they're dealing with. And they feel like they're in a position where they can be open and vulnerable and share. Because people oftentimes want to feel better. They may not know how, they don't know if it's ever going to happen, but they are desiring someone to understand, but they just don't know what to say. So when you ask, you may give them the courage to be open. So if you're concerned, ask. Youth who talk about suicide will never attempt it. So sometimes we think because they talk about it and they've gotten it out, that it won't happen, but that still could be a risk, that they may really be thinking about it, maybe planning, researching, and so we don't want to just assume the coast is clear because they've been open about it. Suicide attempts or deaths often occur without warning. A lot of times there are signs that may be happening. Again, if someone's researching, sometimes people may start writing notes. Maybe they're apologizing for things, or they're saying, I'm gonna, leave this item for you because I know you always liked it. Again, that decline that can be happening, that's just very atypical for that person. So those are signs that we need to pay attention to. We think that suicide can't be prevented, and that's also simply not true. And that's, isn't that great? We have Dr. Leesha and Meesha, our names.
Like it on the road.
Perfect, yes. But so there are real things that we can do. And the first thing is the fact that, again, all of you are here to talk about it because you recognize it's a big deal. Second leading cause of death after accidents. That is a huge, huge number. And I have lost young people to suicide, and it's always devastating. It's just heartbreaking. So, and I had when I was in my child fellowship, it was a guy in my program. Well, actually, I was at Emory, he was at Morehouse, but we were in a child fellowship at the same time, our child rotation at the same time, and he ended up dying by suicide. But we were in lunch together, like we talked all the time, and I never knew. He never said anything to me, and it just rocked my world because it seemed like it did at that time. It felt like it came out of nowhere. But we can prevent it. We have these conversations when we take our young people seriously, when they're saying, I'm not having a good day, or it's been a bad stretch, and we don't dismiss it. And sometimes, the tendency is like, man, life is good. You just gotta go to school and get your homework done. You're not stressed, you don't have bills to pay. Like, what are you complaining about? But high achieving does not mean no stress. Just because you live in a nice house and your parents have a good job doesn't mean no stress. Like the pressures that are on our children, even just looking at like college admissions, the number of applications, but the number of acceptance. So application numbers are increasing, but acceptance hasn't gone up. That's stressful, trying to figure out, like how I'm gonna juggle sports. My parents want my grades to stay up. I'm trying to figure out, relationship stuff. I mean, and somebody's talking about me on social media. Gun violence, worried about school shootings. I remember when I got a call from my oldest because there was a kid with a gun at Hoover City School, at Hoover High. I mean, that was awful. Like, I didn't have active shooter drills. Meesha and I talked about this. I had tornado drills, and I was on the floor like this, covered my head. That was about the extent of it. But an active shooter drill, that's horrific. And if you have a kid that is anxious, just imagine how that dramatically escalates their anxiety on a daily basis, or what might happen. This is one of my big ones. Teens who threaten suicide or attention seeking. A lot of times it can feel like your young person is being manipulative. They're trying to get something from you. But I often say, all behavior is purposeful, right? And so that is communicating a message. You may not understand what the message is, but that to me is like a cry for help. So we don't want to make assumptions about what the intent is, but like, hey, there's something going on and we need to talk about it. And then only girls engage in self-harm behaviors. And the truth is, yes, more girls than boys do engage in self-harm, but that doesn't mean that boys don't engage in self-harm. I think it's about twice the risk in girls versus boys, but we have to be on guard in both boys and girls. Okay, so these are some things I think we just need to know some of which I kind of already touched on, but like life is hard, right? Especially for our kids, and they have real concerns. Like I said, school shootings, COVID, college, relationships, schoolwork, they have a lot that's on them. And even though it may not seem pressing to you, it's a big deal to them. And we just can't ever lose sight of that because their concerns are real and valid. Check on your strong friends and the tough kids, the smart kids, the popular kids, the ones that you think are good because you never hear anything. They always are showing up. Their grades look good. They're going to the college they want to. But that doesn't mean that everything is perfect. We think about like treading water. So maybe your head's bobbing above the water, but down underneath the water, you are frantically paddling, trying to stay afloat. So we just need to check in, need to ask, how are you really doing? Not that like glib, I'm okay. Because kids will do that to me that I see, and I'm like, is that a good okay or bad okay? And they're like, okay. But I'm still gonna push because I need to know, like, what does that really mean? Healing is a journey and not necessarily linear. So in that path, it doesn't mean that you go from A to B to C to D to, like that's just not how it goes. Sometimes you are moving forward 3 steps, you take 2 steps backwards, then maybe you take a half a step forward, but it's a lifelong process, and mental illness is chronic. And so oftentimes, just like if you have asthma or diabetes, it's something that you're chronically working on and need treatment for. And treatment doesn't always mean medication. It may mean that you're exercising and going to therapy, but it is something that you will work on and work towards for the rest of your life. And I got this from social media because I really like it. We listen and we don't judge. You've seen that? Those, yeah. But that's what we need to do. I had a kid when I was in my child fellowship. He told me he put my name in his phone as the big ear because that's what he saw me as. So I was a resource for him to talk. And so, sometimes we don't need to give advice. Sometimes all we need to do is be present, available, and engaged. Not on our phones, but like locked in to hear what they have to say. Because if we're not locked in for the little things, they are not coming to us for the big things. So we need to be present and engaged. The presence of a mental illness does not mean you're unhealthy or that positive mental health is not available to you. Trust your gut. I can't say that enough. Like if something doesn't feel right, ask. We say if you see something, say something. Same kind of thing with your kid. If just not sure, ask. Because you don't want to miss it. Your kid's struggles don't mean you have failed as a parent. It's not your fault, but. So I say this to say, there are clearly some things that we can do that do not help move the needle, right? So again, that's being dismissive, that's saying, I don't know what you're stressed about, you got it good, not listening, not making time. But it doesn't mean that we have failed if our kid gets a diagnosis. Like, we don't get to control the genes that we share. A lot of times psychiatric disorders have a genetic component. And so you don't get to say, yeah, I'm gonna give these chromosomes and these genes, but not that. We just don't get to do it. Temperament, same kind of thing. My children don't look like me, but the girls act like me. Despite my best efforts to save them from the less lovely parts, they got all of it. So we don't get to control that, but there are still things that we can do to make sure, again, that we're having ongoing healthy conversations about the little stuff, the big stuff, the in-between stuff. And we're, again, present and engaged. Treatment is available. There is help. That's me, the big ear, the psychiatrist. There's therapy, there's lots of different types of therapy. Exercise for milder symptoms, exercise is, well, it's good across the board, but exercise isn't necessarily going to be sufficient if you have pretty severe symptoms, but exercise releases feel-good hormones called endorphins that are like natural antidepressants. It also helps release something called brain-derived neurotrophic growth factor, which helps with cognition. So move your body, it's good, you feel good, you look good. So exercise is good. Therapy is fantastic because once you stop taking medication, it doesn't work anymore. But therapy really changes the way that you process information, the way that you manage stress. And these are lifelong skills that will help you irrespective of whether you have been diagnosed with a psychiatric illness. It can work wonders. And then medications are also a big part of that as well. If your kid has asthma, you wouldn't say, hey, just tough it out. You got it, just breathe. You wouldn't say that. That would be ridiculous and offensive because they would, and you'd be like, just breathe. No, so we don't need to say that to our children. Just tough it out. If they are struggling, that might be part of it. It's a conversation you need to have with their provider, their healthcare provider, but we don't want to just, minimize what's happening. And then normalize these conversations, which is why we're here. We got to talk about it. We talk about the easy stuff, the hard stuff, it doesn't matter. But we have to keep talking to our children. All right, treatment, I kind of already covered that. Therapy, meds, non-pharmacological treatments, so I think those can be really helpful, especially when you think about like anxiety, tools like progressive muscle relaxation, breathing exercises, meditation can be really helpful. Where do you get help? So your pediatrician, family practice doc, internal medicine, mental health providers, there's different types of therapists, psychologists are PhD or PsyD who provide therapy or do testing, and then psychiatrists are physicians who prescribe medication and can provide therapy. What can we do? Talk to your kid. Even when they're grumbling at you and act like they don't want to hear anything you have to say, they're still listening. Validate their feelings. Like, I get it, yeah. Or maybe I don't understand all of it, but I can see how that might be difficult for you. Trust your gut. Work on your own stuff, right? We have to make sure we are modulating our own emotional response because sometimes we will inadvertently make things a whole lot worse because we are not in a good place and we're not taking care of ourselves. So we need to be working on our things and be a good role model. And then 3 R's can be helpful. Rest, because nobody gets enough sleep. And sleep is critical for all kinds of reasons. Our physical health, repair that our body needs to do cognitively, all kinds of reasons. So tell them to get off their phone. You get off your phone too, off your iPad, off the computer, off the TV, and go to bed. Have a routine, because there's stability in routines and structure that can be really grounding. And then relax, like we need to, now again, I would love to take family trips, but everybody doesn't want to go with me anymore on my family trips. But I hope one day we'll get back to that at some point. But we need to relax and have, I know I'm saying too much, right? We need to relax and have a good time. Connect. And there's an author that I like, Dr. Becky Kennedy, who's a psychologist, and she says connection before correction, which I really love because you get in and you're engaged and connected, and that's going to work a lot better when you're doling out your sage parenting advice, when they feel seen and heard and valued. So connect before you correct. Don't lose hope because treatment is available. Foster resilience, that's the ability to thrive in the face of adversity. Don't forget to ask for help because help is available. Even if it's like you just talk to a friend, like, I don't know what's going on. Have you seen anything? Have you noticed? What do you think? What should I do? And then team up because we have a community. That's so much that I love about Hoover. But we really have a community in our schools, with our friend groups, with our places of worship, with our neighborhoods, and so we can really do a lot when we work together and team up as a community. These are just a list of resources that can be really helpful in terms of websites, online therapy options, and then 988, so that replaces 911. So if you are in crisis, then 988 would be the number that you would call. I always show these beautiful people. One, because I always like I get it. not that you have to be a parent to get it, but like I have lived experience with this stuff. I've been in the trenches working with my own children, who you would think would be perfect because I'm a psychiatrist, but somehow nobody's, not even me, nobody's perfect. And because we take them every year, and I think the photographer somehow makes us look amazing, so I always like to remember that I can clean up well. But lastly, and I think most importantly, is just like, it's my why. This is why I get up and do what I do, and it is a reminder of how important we are to the little big people in our lives, and so many other people. And so I just don't ever want to lose sight of that. So with that, I'm going to stop talking, and I'm going to, I think, unplug.
We're going to take a just about 5-minute break, so if you guys want to get...
This is the interactive part of the program. So I want to establish that I am not a mental health care provider. I have some unique experience just as a human living life. But as they said earlier, my name is Meesha Emmett. I am the Alabama Area Director for the American Foundation for Suicide Prevention. This is something, honestly, that I never wanted to do. A club that I certainly did not anticipate being a part of. Because what led me here was that the suicide of my best friend. And it was devastating. And like you, I wanted to do something to keep other people from having to experience the same pain that I did, and to help myself start healing. So the information that I'm going to share with you this evening is, they're slides from AFSP's flagship program called Talk Saves Lives, because it can, right? This is very simple. Talk can save lives, as you heard. Some of the information that's going to be shared, there's a little bit of overlap, and that's fine. You can never hear these things too much. But at any time, if you have a question, please ask. Also, talking about suicide, because I'm going to be speaking only about suicide. It can get really heavy. It's heavy for me to do this every day. So your safety in this conversation is the most important thing. So if you feel overwhelmed or activated by something that you see or hear, please, please, please feel free to step away and take care of yourself. So this is a little information about AFSP. The American Foundation for Suicide Prevention is the largest private funder of suicide prevention research globally. I'm very proud of that. Our mission is simply to save lives and bring hope to those affected by suicide. We work to create a culture that prioritizes mental health, suicide prevention, and loss support by funding scientific research, educating the public about mental health, suicide prevention, and suicide loss, advocating for public policies that support mental health and suicide prevention, and supporting survivors of suicide loss and those affected by suicide. So mental health matters. This is a really important statistic. Sorry, I'm going to move around a little bit, but so 90% of people who died by suicide were shown to have a mental health condition at the time of their death. However, it's extremely important to understand that most people with mental health conditions do not engage in suicidal behavior or die by suicide. So what it's saying is, you can live a completely happy, fulfilled life while managing a mental health condition. I do. Lots of people do. You know, establishing a culture that's smart about mental health, it sounds easy, but it's not. It's not something that happens in a silo, right? It's not something that happens with schools or with hospitals or with workplaces or faith communities. It's something that takes everyone. Everyone in a community has to make an informed decision that we're going to work together to reduce the stigma and hopefully end suicide. As Dr. Leesha said, how we talk about suicide, how we report suicide in the media, it matters. And this thing that seems really small could literally be the difference between life or death for someone. Right? As she said, saying committed suicide, it implies judgment. It's unnecessary. Calling suicide attempts failed or successful, it's just not helpful, and it's perpetuating the stigma that we're trying to eliminate. Instead, we're encouraged to say died by suicide, had a suicide attempt, ended their life, death by suicide. As I said, I'm a suicide loss survivor. A family member or a friend, in my case, my best friend, died by suicide. Another way to say that is a survivor of suicide loss. I'm suicide bereaved by suicide. A personal lived experience is a person who has had a previous suicide attempt, or they could also be called a suicide attempt survivor. So suicide is a leading cause of death in the United States. Each year, millions of people contemplate suicide. There are well over 1 million people in the US each year who do survive suicide attempts. And most people have been affected by suicide in some way. Research shows that 1 in 4 people will be affected by a suicide loss in their lifetime. If you feel comfortable, if you've been affected by suicide, could you please raise your hand? It's a very large percentage of the room. And though suicide is a leading cause of death, it's the only leading cause of death that's 100% preventable. And again, that's why we're here. So we talk about suicide big picture, right? And it's easy to think, not here, not in Alabama, that happens in New York, California, somewhere else, not here, right? But it's simply not true. The latest research available showed that 837 people died by suicide in Alabama. 837. 1 is too many. But that's mind-blowing. To know that many people found themselves in that intense state of despair and hopelessness and couldn't access or didn't think that they could get help. Now, the children are not okay. So, the title of the program. They're not. It's not captured here, but, we're in a crisis. I don't want to sound alarmist, but we truly are. So many things now have made being a kid, a teenager, so much more complex than it was, when I was growing up. And I'm comfortable with sharing with all of you, and I'll talk more about my story at the end, but the struggles that I had, I would not have survived high school as a student right now. The pressure is unbelievable. There are lots of different things, and we're going to talk about risk factors that contribute to suicide ideation, some of which you've already heard. But this is critically important that everyone understands, there's a lot going on, and children are not immune. They have access to so much information in an instant. Information that their brains literally can't process as quickly as they're taking it in. So just keep that in mind as we move on. Some of the staggering statistics in Alabama, 48%, maybe that's not surprising, right? We do live in Alabama, but 48% of suicides were by firearm. Firearm ownership, that's not something that a political debate that we get into. Own a firearm. We just want people to own them and store them safely. The likelihood of a suicide death in a home with a firearm far surpasses a home without one. So we just want to educate people on ways to limit access to those lethal means. And then here's some data about just overall suicide rates across the United States. We're not the highest, thankfully, but again, one life lost to suicide is too many. So the thoughts of suicide are complex, right? It's not that people want to die. They're just ambivalent, right? A part of them wants to live, but a part of them wants the intense pain that they're experiencing to end. A lot of times people think that if they weren't here, it would be better or easier for their family or friends because maybe they feel like a burden. They're overwhelmed with feelings of despair and hopelessness. So the perspective of a person in crisis, at that moment, they're kind of at rock bottom, and that unbearable physical or emotional pain feels unescapable. And their brain in that moment is operating differently, and it lacks flexible thinking. So I want everybody to imagine the most painful experience you've ever had in your entire life. Just nod when you got it. We got it? In that moment, would you be able to tell me, a stranger to most of you, exactly how to get to your house? Something that you do every single day, something that you do without thinking about it. If you're experiencing the most intense pain of your life, would you be able to very clearly give me directions to your home? No. That's what that feels like. And I'm telling you because I know that through this work, but I'm also telling you because I've lived that. Day to day, our thinking, the way we see the world, right? Got this broad worldview. Then that intense pain creeps in, and the way you see things is like this. And it's intense, and it's all you can focus on, and you just want it to end. You know all the reasons, like I said, there are things that connect you to wanting to be here tomorrow, right? But there's also a part of you that just wants the pain to end. And here's how it happens, right? Here, it's when these different factors converge, right? And then they are set off by a life stressor or life event, and then they have access to lethal means. That's oftentimes where we see a death by suicide. So if our neighbor, John Doe, right? John has recently lost his job, and he dies by suicide maybe a couple of days later. The assumption would be that that job loss was the cause of his suicide. That was the reason. But that's never the full story. It's never just one thing. And we'll get into it in another slide, but there are different factors. Maybe John has a family history of mental illness, right? Coupled with maybe excessive drinking and not getting good sleep. And then that job loss happens. And he's a firearm owner. It's created this perfect storm, if you will, of circumstances that have made it easier for him to end his life. And here, like I said, here are what some of those things look like. Like maybe it's access to care, genetics, previous suicide attempts, lack of support, trauma, a traumatic brain injury, abuse or neglect, family history, social skills, pain, a lack of problem-solving skills, lack of resilience, substance use, a chronic health condition, all those things make it harder to cope with those life events and life stressors. There are some distinct contributors to suicidal behavior. Previous suicidal behavior, mental health conditions, physical health conditions, family history of mental illness or suicide loss, childhood trauma, those adverse childhood experiences like she mentioned earlier, the traumatic brain injury, genetics, and then those social factors like rejection, victimization, race or gender-related discrimination, prejudice, systemic racism, and historical trauma. All of those things make life harder, to put it simply. And I think, when we have conversations about suicide, all of us have probably at one time or another heard like it's a permanent fix to a temporary problem, right? That's what this is saying. That those intense feelings are often temporary. And keeping people safe and helping them feel supported can get them through those critical moments. The biggest lifesaver, the most important thing that you can put between a person wanting to end their life and that access to lethal means is time. Time for that crisis moment, those feelings of crisis and despair to subside and get them connected to help. Or just, time in general, just waiting for things to calm down so that they can then try to process and talk about what they're going through. Just like there are risk factors, there are protective factors. Protective factors are those things that connect people to their reasons to want to continue living. Right? The strong sense of personal identity, including race, gender, and ethnicity. Strong social and problem-solving skills, the connection that we heard earlier, social support, a willingness to participate in mental health care, and access to mental health care. Those are all things that serve as protective factors. I'll pause here and say, again, this is just a snippet of our program called Talk Saves Lives that I hope you'll want to learn more about later. But these statistics that we've talked about, it's extremely alarming, right? And it makes you feel helpless, especially if you know someone or if you've lost someone. If you know someone who struggles or if you've lost someone yourself, you can feel like, well, this is too big for me. What can I do? There's a lot that we can do. There's small things that we can do. We've talked about our language already. The first thing is watching for warning signs. There aren't always warning signs, but there are a lot of times too. Research has shown that those warning signs present themselves in 3 ways: through talk, behavior, and mood. So talk, some people, not all people, some people speak very bluntly about their intent to end their life, and we should take it seriously. They might say things like they have no reason to live, they feel hopeless, they're a burden, they feel trapped. They talk about that unbearable pain. The behavior that's a red flag, that increased use of drugs or alcohol, issues with sleep, reckless behavior, withdrawing from activities, especially activities that they enjoyed, isolating for family and friends, actively looking for ways to kill themselves, giving away possessions, missing work or declining school performance. And then mood. Some of the things listed here under mood won't surprise you, right? Depression, apathy, rage, irritability, impulsivity, humiliation, anxiety. But we get questions a lot about the sudden, unexplained happiness that people who are experiencing suicide ideation, that they feel or that they display. And oftentimes that's because they've made the decision. They have decided on a plan, and they know that intense pain will soon be over. And that has been the most heartbreaking thing to see. Just, we thought that we had turned a corner, you know, they were happy, but that's why. Again, every situation is different. Everybody is different, right? So some people will display warning signs, some won't. It's just, you know, pay attention to your people. Pay attention to yourself. If you notice something is off within you, say something or seek treatment for yourself. Having an honest conversation is extremely important. Trust your instincts always, and always treat every situation that you think someone might be in danger of harming themselves or ending their life like you are the only person that is picking up on this very subtle thing, because you might be. We've got to treat every situation with care and that amount of attention. And just be okay with the awkwardness, right? I mean, I know as parents, you could care less probably about awkwardness with your kids, but when we're talking to peers and things like that, you know, we're in this culture of, I don't want people in my business, I don't want to get in their business. Get over it. Like, if it's gonna save somebody's life, forget about it. That's not a good enough reason to not act on what you're noticing. And then here are just some reminders before you reach out. I mean, what I always say is the golden rule. Apply that here. Treat somebody in that moment like you would want to be treated when discussing or sharing information about the most, the most hopeless, the most fearful situation you've ever found yourself in. I mean, imagine that type of despair and what you would want, how you'd want somebody to handle you, right? We're listening and not judging. We're validating their experience and their feelings. We're not trying to fix it, right? We're just listening to find out how we can help. You know, we're not projecting our stuff onto them. Our goal with this is just to listen and get them connected to resources. You know, ask them open-ended questions and listen to the responses that they give. Show empathy and support with your words and with your body language, but you're also listening for those warning signs, the words that are triggering the red flags in your mind. And ask directly about suicide. This is a question we get a lot too. Do I have to say suicide? Yes, you do. Because saying, are you thinking of hurting yourself, to a person that's engaging in self-harm but maybe is not, you know, suicidal, that's two different things. So you have to be able to say the word. And Dr. Leesha spoke earlier about, you know, this myth that, you know, talking about suicide plants the seed. That's why lots of schools are hesitant to engage in programming for suicide prevention, because, you know, that's scary, but it's not true. And research has proven that. And even if you find out they're not thinking about suicide, just continue to keep that dialogue open, listen to them, and provide support. And if they are thinking about suicide, find out more. Find out if they have a plan, if they've thought that far. So you can figure, you know, you can kind of gauge their crisis and determine who you need to connect them with. Thank them for sharing with you. This is not easy. Talking about your business out there is not an easy thing to do. It's not easy for teenagers. It's not easy for adults. It's not easy for senior citizens, right? But we've got to do it. We've got to ask them about it, and then we've got to show gratitude that they trust you enough to engage in this conversation with you. Again, we're keeping the dialogue open, reminding them that you're there for them, connecting them with resources, and staying in touch. And again, keeping the environment safe. This is the most important slide in the presentation. It's just that time. Time is life-saving. It allows that moment of crisis to de-escalate and provides an opportunity for you to get them connected to help. Limiting access to lethal means, also critically important. Removing or securing firearms, always storing your ammunition separately than the firearm itself, securing medication, even over-the-counter medication, securing any toxic substances. If you find yourself in a situation where you're in someone's space and limiting that access to lethal means, ask them. Because there may be something that I think that's dangerous to me that you might not perceive as dangerous to me. And I might need you to remove this thing to help me stay safe. And be very direct in your dialogue. Ask them to refrain from substance use. And then encourage them to talk about what that safe environment looks like with the mental health professional. Here's some more statistics about suicide and firearms. Nearly half of all US households have at least one, and around half of the suicides in the United States involve firearms. In some states, firearms are used in as many as 70% of suicides, and most firearm deaths are suicides in the United States. Who's heard of 988? Raise your hand again if you have. Okay, close. This is the closest I've ever been to a full room of people that know about 988. So 988 is the mental health equivalent of 911, right? You're not being connected to a well-intentioned police officer or other first responder that may not have mental health training. You're being connected to someone that knows what to do, right? So if I experience a mental health crisis right now and Dr. Leesha calls 911, they're gonna call, the police officer's gonna show up. Well-intentioned as he or she may be, more than likely they're not gonna know what to do, right? I mean, she would know what to do, obviously, but if she were to call 988, she would be connected to a trained professional that could help her help me, or if I were in a space where I could speak to them directly, help me help myself. Very important. There are options for English and Spanish speakers. I cannot underscore enough how important 988 is. So 988 was established in July 2022. It's a federal program, every state has it. It's up to the states though to continue the funding for it. AFSP, NAMI, lots of other organizations have been working with the Alabama Department of Mental Health to sustain funding. At one of the public hearings in Montgomery, I heard such an alarming statistic. So from July 2022 to April 2023, how many people in the state of Alabama would you guess, called 988? Anybody, just a number. 1,000, anybody else? I guess? 36,000 people. 36,000 Alabamians found themselves in that type despair. And thank God they had somewhere to call. That gives me chills every time I say it. Right? In 1 month, I think it was May 2023, it's like 1,800 calls. Of the 1,800, 800 were veterans. And that is a whole nother soapbox that we do not have time for. But we've got to do better by the men and women who serve this country. There's a dearth of resources available to them, and it's just, they are not okay either. But maybe that's a follow-up session. But I just share those statistics with you, those numbers with you, so that you understand that this is happening, this is real. These people may not be talking about calling 988, but they are. You know, we're very fortunate in this community to have the Crisis Center in Birmingham. They've got the crisis line, they've got a teen line, they've got a senior talk line. A lot of people are really surprised to learn that there's a very high suicide rate among senior citizens. You know, if you think about like isolation and things like that, so they established the senior talk line so that they could just have human connection. And it's life-saving. So again, we've got great resources. We've just got to get them into the hands of people that need them and use them ourselves if we do. You know, youth now, they don't like having conversation sometimes. And so you can text the talk line, right? These are resources. AFSP is very good about understanding that different communities, different demographics of people have different needs, right? And you have to meet them where they are. So we try to share resources that do just that. You know, the Trevor Project, the LGBTQ community has, you know, very different issues facing that community, as I'm sure you're all aware. But again, just take a picture of this slide. We've got some resources over on the table too. But like I said at the outset, 1 in 4 people will be affected by a suicide loss in our lifetime. So these things aren't like if I need them, but it's when I need them. You know, it's like insurance. It's always better to have it and not need it than need it and not have it. Obviously, if it's a medical emergency or a suicide attempt in progress, call 911. And never, ever, ever, no matter how bad you want to help, if there's a suicide attempt in progress with a firearm, keep yourself safe and call 911. And these are ways to connect to professional care. Some websites like SAMHSA, Mental Health America, and Inclusive Therapists. And we always prefer, you know, prevention, but postvention is prevention too. Like when a suicide has taken place, there's still a lot that we can do to save more lives. So, as I said, I'm a suicide loss survivor. This is me in my glory days, the awkward adolescent years. And this is my best friend, Alex. Alex is my why. She died on May 2nd, 2013, and it blew my world up. You know, I grew up in the 90s, and conversations like this weren't being had. You knew you were struggling, you knew your friends were struggling, but it's just, everybody just kind of struggled in silence. Self-harm was happening then, you know, with that age group. Self-harm's not a new thing, it's been happening for a long time, but it didn't set off the red flags that it sets off today. It's just like, yeah. And it sounds horrible to say that, but I mean, it's true. So when I was middle school, I was diagnosed with anxiety and depression. It was really rough, had a really rough go of it. I'm from Florence, Alabama. It's not the most diverse place in the world. I went to Catholic school, so the diversity gets even smaller and smaller and smaller. And I struggled a lot. You know, I didn't have the language at that age to say, I think I'm having an identity crisis. You know, I'm not seeing a whole lot of people that look like me. I have a fantastic family, great parents. But I just struggled, and I struggled in silence for a long time. And I'm Black, I'm Catholic, you know, those are some pretty serious cultural things working against me in terms of initiating a conversation about mental health. You know, I remember when I told my mom for the first time, like, I'm really depressed. And it was just like, you've gotta just pray, you know? Like, you gotta have faith, just pray. Everything will be okay. That thinking gets more intense. Finally, they understood. I got help. I take medicine every day to manage those things. Like I've said, different things work for different people. Alex had a hard-fought battle with bipolar disorder. And like, she was sick and she fought hard. The survivor guilt, you know, all that stuff sets in. I struggled. What was the difference? Right? I struggled, I knew she struggled. Why didn't I know? People don't know what they don't know. You know, I was a kid. I wish so badly that we would have had a program to know how to talk about these things, to know how to say, I'm noticing you're off. You know, I was at rock bottom before I was able to say something about myself. This stuff is so important. Like I said, training, this professional training, I know this information because of that, but I know it too because of my own lived experience. Every single thing in this presentation, in all of our prevention education programs, they're research-driven, they're research-based and data-driven. These are facts. Every time I go to a school, you know, which is so hard to do, and I'm talking to an auditorium full of kids, the first thing I ask them is, raise your hand if you have a best friend. They raise their hands. And I'll ask y'all too. Raise your hand if you have a best friend or somebody in your family that you would do anything in this world to keep them safe. Yeah. That's who she was to me. And I didn't have the resources to keep myself safe, really, or to help anybody else. So I do this every day to make sure that y'all do. You know, again, the kids are not okay. My first 3 months, I think, on the job, this thing happens, a death occurs, and you know, there's a lot of us that are engaged in this work, and you find out. And so it's like, I get calls, right, letting me know so we can send resources to the family, to the survivors. And it was like, one school had 2 losses. One on one Saturday, one the next Saturday. Small community. It just obliterates any community because the ripple effect of one suicide death has shown to be about 119 people. Then you take those 119 people, they have their own ripple, and so on and so forth. Everybody's affected by this, guys. Anyway, that first 3 months, I ended up getting a total of 5 phone calls, which is a lot. They were all kids. There's this bracelet, because I fight nervousness and anxiety when I do this, but the dad of a 12-year-old little girl in Montgomery gave me this bracelet. A 12-year-old. He had just buried his 12-year-old, and he said he had worn it every day since her funeral. So this is my reminder. And I'm going to continue to do this work until we're just at a place where we don't have to, because suicide does not exist. AFSP can't do this alone. HooverTogether can't do this alone. NAMI, UAB, all the places, Dr. Leesha, we cannot do this alone. Everybody's got to be on board. Everybody has to be committed. That means your workplaces, your faith communities. We have to start normalizing these conversations everywhere. Because you can talk to your kid about it all day at home, and they can hear about it at school, but if they go to church, and that's something we don't talk about here, or they go to a friend's house and they don't talk about that there. You know, their list of protective factors gets smaller and smaller. Their list of safe environments gets smaller and smaller. Suicide claims more lives every year than natural disasters, car accidents, and homicides combined. It's the only leading cause of death that's 100% preventable. This is a huge first step. But we've got a lot of work to do. And I do believe, and I pray that in my lifetime, we will have established a culture that truly prioritizes mental health and suicide prevention. Thank you guys so much.